Many older adults take vitamins every single day, believing they are protecting their health, trying to support their memory, their energy, their bones, their heart. And honestly, that intention comes from a good place. But after age 60, the body no longer processes nutrients leans the same way it once did. The liver changes. The kidneys may work more slowly. Blood vessels become more sensitive, medication interactions become more complicated, and in some cases, taking too much of certain vitamins over time may quietly place extra stress on the body without obvious warning signs in the beginning. And that is why more doctors today warn older adults about supplement overload. Because the real problem is often not one vitamin alone. It is accumulation, stacking, multiple products taken together every single day. Today, we'll look at the top 3 most dangerous vitamin mistakes after 60 and why doctors want seniors to be more careful about how these supplements are used. The first one is too much vitamin A. Vitamin A is important for vision, immune function, and skin health. But vitamin A is also fat soluble, which means excess amounts can build up inside the body over time, especially in the liver. And this is where many older adults become vulnerable without realizing it, because liver stress does not always create immediate symptoms. The body may stay quiet for a long time, and many people never realize their total vitamin A intake is becoming too high. A multivitamin may already contain vitamin A. Then an eye health supplement adds more. Then an immune support formula adds even more. And suddenly, the daily amount becomes much higher than expected. Some experts have raised concerns that excessive long-term vitamin A intake may be linked to liver stress, bone issues, or an increased fracture risk in some older adults, and this becomes more important after 60 because aging already affects bone strength and liver function over time. That is the hidden mistake, not one pill, accumulation over months and years. Now let's move to the second vitamin mistake. Too much vitamin E. For years, vitamin E became strongly associated with healthy aging and antioxidant support. And because it sounds natural, many people assume it must always be harmless. But high-dose vitamin E supplements may not always be safe for everyone, especially older adults taking blood thinner medications related to heart and circulation health. Vitamin E may affect blood clotting in certain situations, and when large doses are combined with medications like aspirin or anticoagulants, certain risks may increase for some individuals. And this is where many seniors become overwhelmed, because they are not only taking vitamins, many are also taking prescription medications every day. Blood pressure medication, cholesterol medication, diabetes medication, sleep medications, heart medication, and sometimes the combination of everything together becomes harder for the body to manage with age. That is why doctors often ask older adults to bring every supplement bottle to appointments, not just prescription medications, because interactions matter. Now, here is the third vitamin mistake, and this one has quietly become extremely common. Too much vitamin B6. Most people think of vitamin B6 as an energy vitamin, and in appropriate amounts, the body absolutely needs it. Vitamin B6 plays important roles in metabolism, brain function, and red blood cell production. But modern supplement products often contain megadoses far above daily requirements. Energy drinks, stress formulas, metabolism supplements, sleep aids, multivitamins, and many older adults combine several of these products together without realizing how quickly the numbers add up. Over time, Very high levels of vitamin B6 may be linked to nerve-related symptoms in some individuals. Tingling, numbness, burning sensations, balance problems. And because aging already affects circulation, nerve sensitivity, many seniors assume these symptoms are simply part of getting older. That is the dangerous part. The body may be reacting to overload while the symptoms are mistaken for normal aging. And this is why doctors are becoming more cautious about long-term high-dose supplementation. Because after 60, the body becomes more sensitive to repeated daily stress over time. Now, this does not mean older adults should fear vitamins. Not at all. Some people genuinely benefit from supplements. Deficiencies happen. Absorption changes with age. Certain medical conditions may increase nutritional needs. But the key is balance, not excess, and not assuming that more automatically means healthier. That is one of the biggest misconceptions in modern supplement culture. The body does not respond to marketing promises. It responds to biology. And sometimes the healthiest thing a person can do is simplify. Review every supplement carefully. Check labels. Watch for overlapping ingredients. Pay attention to dosage levels. And if symptoms appear after increasing supplements, fatigue, brain fog, digestive discomfort, tingling, sleep changes, it may be worth discussing with a healthcare professional, especially if multiple medications are already being used. Because after 60, the body deserves more thoughtful support, not overload. And perhaps that is the most important message from today's video. Healthy aging is usually not about taking more and more supplements. It is about understanding what the body truly needs and avoiding unnecessary stress over time. Because sometimes protecting your health is not about adding another bottle. It is about knowing when enough is already enough.